Today had a facelift by me February of 18.
Yes.
So almost 3 years ago. And she is a massive weight loss patient, lost a lot of weight. Relatively young for a facelift and neck lift, but one of the things about losing a lot of weight is that it can kind of make things loose. So we're working on trying to get rid of some of the looseness down here. Typically, you know, more of an aging situation, but she's still very young, but it's the weight situation, right? Something
Right.
like that. Something like
And
that.
I'm a great patient.
And she's a great patient, absolutely. Right now we're putting in some what's called tumescent fluid, which helps to dissect the planes and cut down on bleeding and give a little pain relief. This one is 25 cc's of lidocaine, 2% plain, and then 1 cc of epinephrine, 1 to 1,000 in each liter. Ethibond, I mean, I used it. It's a permanent braided suture, but I really prefer not to use the permanent one, so I'm going to use a PDS instead for suspension, but you can see the blue stitch there. The surgery took about 2.5 hours, but 2.5 hours. We did a secondary facelift. It's a revision facelift, so sometimes the skin gets a little bit loose after a while. It's pretty unusual to go back in 3 years, but she wanted to try to tighten it up again, so we went back and through the same incisions, opened everything up, and then tighten up the deep layer, which is called the smash layer, to give her the deep tightening, and then we redraped the skin and took a little more skin off to smooth things out a little bit. Actually a primary facelift, and depending if we're doing more, it could be more like 3 to 4 hours. So because we weren't going to go under the deep layer again. She'll be with this bandage for 24 hours. There are drains that will come out tomorrow. The stitches come out within the first week. A lot of bruising and swelling for a few days, some minor discomfort, which is handled by pain medicine, and generally about 2 weeks before she'll be more presentable for socialization, and then about 4 to 6 weeks for vigorous activity.